We are so glad that you're able to join us today for our webinar on Student Health Services. My name is Meredith Call, and I serve as the Director for the Office of Parent and Family Services here at UAB. And so we're very excited that you're able to join us for our live webinar today as part of our summer webinar series for our family members. We know that there are a lot of questions and processes that you're trying to determine and figure out as you're getting your students and yourself ready for them to start the fall at UAB, start this fall at UAB. And so we want to make sure that we're taking the time and opportunity to share the information and facts and details about programs and services that you need to know in order to ensure that your student is starting off on the right foot. So a few things that we want to make sure that we are able to do today is, one, we want to make sure that this is a very interactive session that we're able to offer and answer questions both of our family members. And we are also broadcasting this webinar both live through the Zoom platform as well as also on our Facebook Live platform. So we will be watching for those questions to come in through the Q&A option on the Zoom platform or through the comments section of our Facebook Live if you're watching us that way. So please know that if you do have questions or concerns, please make sure you put those in so that we can make sure that we address those during today's session. We want you to be aware, though, that since this is a live presentation, we do ask that you're very careful about the questions that you put forth so that you're not identifying anything specific about your students, either health concerns, full name, Blazer ID, email address, anything along those lines that could identify your students, since we want to make sure that we are maintaining the health, the security and privacy of all of our students. So I want to take a moment and introduce Carol Griggs from our Office of Student Health Services, because she is going to be able to share with you all of the opportunities, programs, services, and requirements for our students as they are coming into UAB and starting. So Carol, the show is yours.
Hi everyone, my name is Carol Griggs. I'm the Administrative Director at the Student Health and Wellness Center. And today I'm going to be talking to you about some of the services that we provide and providing somewhat of an overview of a few requirements that I'm sure you have received documentation on. So let me get the presentation loaded so that we can share that for you. Okay, I hope that you can see that. If not, Meredith, definitely let me know. All right, so and I'm actually going to turn my camera off if I can figure that feature out. We'll proceed. So today we're going to be talking about UAB Student Health Services, and again, I'm Carol Griggs, the Administrative Director. And so first, let's start out and talk about who we are. And so UAB Student Health Services is the primary point of contact for all of your students' medical needs on campus. We have a primary care team and on-site specialty care lab, radiology, immunizations, and we also offer allergy care. UAB Student Health Services also manages 2 campus-wide requirements for your students, and that includes the immunization compliance as well as the mandatory insurance requirement. And so where are we located? So students can actually locate us a couple of different ways. The facility that we're located in is actually called the Learning Resource Center. Students become very familiar with calling it the Student Health and Wellness Center. And honestly, if they type either of those in their GPS, it will bring them to us. Our physical address is on the screen, 1714 9th Avenue South. We're cat-a-corner or adjacent to the New Fresh Res Hall, and so we're within walking distance of most of the students that actually live on campus. Our hours of operation are Monday through Friday, 8 to 5. We are closed after hours and on the weekends, and so if students have needs during those times, they can actually contact our on-call provider, which that information is located on our website. They can also visit the UAB Urgent Care Center, which isn't too far away. It's I think about 3 blocks from the res halls. If the student is actually experiencing a true emergency, though, we do recommend that they contact the UAB main hospital. They can dial 911 to go to the nearest ER, or they can visit the UAB Highlands ER, which is a smaller ER, but it's relatively close. If a student needs to schedule an appointment with Student Health Services during normal business hours, they can also do that in the patient portal. They can call us at 205-934-3580. And they also can walk in for triage services. So Student Health Services, one of our primary goals is to ensure that we can deliver comprehensive, high quality care for students. We want to ensure that the service is confidential, it's evidence-based, it's friendly, it's efficient, and really our goal is to ensure that we can support the success of your students' studies, their professional lives while they're students at UAB, but also so that we can help them as they develop in their progression to become young adults. And so for students, and I hope that you can still hear me. It looks like my internet is a bit unstable. If you can't hear me, Meredith,
yeah,
can you hear me?
Yes, we can still hear you just fine at this time.
Okay, wonderful. And so the primary objective for us is just to ensure that we can support your students. We don't want to only offer them services while they're at UAB, but we actually want to enhance their well-being and help them to grow and develop in their own well-being so that they can be better once they leave UAB. And we do this through not only education, but also prevention work and really encouraging them to partner with us on their wellness. And we focus on that developmental piece in almost everything that we do. And so at Student Health, we actually offer services in primary care, sports medicine. We have a sexual health clinic, women's health. We also have laboratory services, radiology services, immunization services, and referral services. In addition to that, we also have registered dietitians and athletic trainers on staff. We offer allergy shot support. We have triage nursing services available as well as health education. And among our staff, we have a wide variety of providers as well as clinical support staff. In our provider pool, we have physicians and nurse practitioners that are licensed in family medicine, adolescent medicine, sports medicine, women's health, sexual health, and we actually have a mental health team embedded into the primary care setting. We have a psychiatrist on site as well as a mental health nurse practitioner. And then among our clinical support staff, there's a wide variety of folks that will be here to support your students, including RNs, LPNs, CMAs, and a whole host of administrative staff. So here at UAB, there are two primary requirements that every incoming student has to meet. And those include the UAB immunization requirement and the UAB mandatory insurance requirement. And so we're going to go over each one of those requirements in the process to ensure that you're aware so that you can help your student to meet these requirements. Immunizations. So every student at UAB, regardless of if they're clinical or non-clinical, as we do have both programs, they have to meet these basic requirements. We're really going to focus on number two. Number one is a health history form that a student just completes in the patient portal. And that doesn't necessarily result in any kind of hold or anything, but the immunization requirements will. And so every student has to be vaccinated for the following immunizations. They have to have documentation of having 2 MMRs. That's for measles, mumps, and rubella, or documentation showing that they're immune. They have to have at least 1 tetanus, diphtheria, and pertussis within the last 10 years. Most students are going to have pediatric DTaps up until about 11. And then they should have gotten a Tdap after that point. If they didn't, they are going to have an updated Tdap on file prior to starting. Students also have to have vaccinations or serology showing that they're immune to varicella, which is the virus that causes chicken pox. Now with that one, if a student has not actually had the varicella vaccine, but they've had chicken pox, they can actually have the serology done, have a blood titer drawn that indicates that they're actually immune to chickenpox because they've caught the virus itself and have developed antibodies. And that is sufficient for that requirement. Students that are under the age of 21 also have to show proof of having the meningitis vaccine. That's meningococcal. And so some students have had a meningococcal probably before 15. They're going to have another one after 15, but before 21. And then the last thing is tuberculosis screening. For the tuberculosis screening, that's really just a questionnaire. And so students log into the Student Health Patient Portal, which we're going to talk about here in a little bit, and they just complete a questionnaire indicating if they've been in a high-risk location for tuberculosis or if they've been exposed or were a past positive. And so those are the primary requirements that students have to meet, and there's a couple ways that they can submit that documentation. So when we review documentation for immunizations, there's a wide variety of documentation that students can actually submit. That there is no one form that fits kind of the catch-all for everyone. Students can submit their immunization certification cards. Those are usually what we call the blue cards or the state registration cards. They can submit written documentation from their physician. Now that has to be very specific. If they submit that, it can't just be a note indicating, that my patient had all of these vaccines and then they just kind of list them. They have to have an actual date that it was given, and on some of them they actually have to have additional information. They can also have the actual blood, what I keep referring to as serology. It's an official blood test or a titer that just shows that someone is immune. It shows that you have antibodies that will fight off a virus or protect you against a virus, and we will take that as well. I do know that previously, in years past, we have actually at Student Health have pre-screened all pre-matriculating students and pulled their immunization records from the state registry. That usually is our protocol. However, this year we have noticed that the state registry has been down a number of times, which has actually prevented us from retrieving that information. And so since that is occurring right now, we're not quite sure when we will be able to retrieve that information. That is still our plan and that is still our protocol. But given that the state registry has been down a number of times, we haven't been able to do that yet. And so definitely have your students continue to check their patient portal. They can send us a message. It might be beneficial if they have that record to go ahead and submit it, and we can review it that way. Now, due to COVID-19, this year the actual deadline for immunizations is a little bit more flexible. We recognize that due to COVID-19, a lot of primary care offices and provider offices are not seeing patients on site. Many of those appointments have been established as virtual visits. And so because of that, students might not be able to actually get those immunizations when they typically would. And so this year, our deadline is a little bit more flexible. Usually it's August the 1st. We are giving students more time. We do strongly encourage them to submit that documentation prior to the first day of class. However, we will work with students on an individual basis as needed. We do offer all of these immunizations in our clinic. And so once they actually get to campus, if they have not met their requirements and they need to, they can come to our clinic to, they'd have to schedule an appointment, but they can come to our clinic to actually get the immunization itself or have a titer drawn to test for immunity. And again, we are going to try our best to check the state registry for those immunization records, but at this time, the state registry is just down. So now let's move on to health insurance. And so every student at UAB that's considered an eligible student is required to have major medical health insurance. Eligible students include the undergraduate students that are registered in 9 or more hours, graduate students per program, international students, and all clinical students. So if a student comes to UAB and they are classified as an eligible student, this process, they can meet this requirement through 2 ways. One, they can be automatically enrolled into the student health insurance plan, which we're going to talk about that in a second, or they can actually have their own health insurance, at which time they have to submit an insurance waiver. And to submit that waiver, there are a subset of criteria that insurance actually has to meet prior to that insurance waiver being approved. So what are those requirements? If a student has their own personal health insurance, the insurance has to, 1, be compliant with the federal ACA benefits requirements. I do have a hyperlink here, but since you're watching this as a webinar, you're not able to click on that. That information is available on our website, and I will ensure that Parent and Family Services has it should you need it. The insurance company also has to be licensed to conduct business in the United States of America. The insurance also has to provide coverage for physicians and hospitals in the state of Alabama for inpatient and outpatient mental health services. It has to also cover pre-existing conditions. The insurance does have to have unlimited coverage per illness and injury. That's one that we often see that actually disqualifies a lot of plans because they do have kind of capitations on certain types of injuries, and that's definitely something to look at. The insurance also has to be active for the semesters of enrollment. So with the insurance waiver. If a student submits a waiver in the fall, we only require that they submit that insurance waiver once a year. And so if a student submits a waiver this fall, they will not have to submit another insurance waiver until the following fall. So that would be fall 2021. So what we do is that we validate that insurance now to ensure that it's active for the fall term. It's actually validated again in October, sometimes November, just depending on how many we have to validate. And then in the spring semester, it's actually validated again, and often it's validated twice. If for whatever reason that student's insurance does not go through when we automatically validate, then they will be enrolled into the student health insurance plan. That does not mean that they can't unenroll if it were some sort of processing error, but that is how the validation of the insurance works. And so we do want to ensure that you understand your student's insurance has to be active for all enrollment, for all semesters of enrollment. So if a student actually does have insurance that meet that criteria, they would simply submit an insurance waiver. The recommendation is to submit that insurance waiver prior to July the 1st of 2020. And what this means is if a student submits their insurance waiver prior to that date, then that ensures that they will not have the charge for insurance on their student account. If they submit it after July 1st, then they might actually see that charge populate on the account. That doesn't mean that they still don't have time to submit the waiver. The final deadline is actually September the 4th, 2020. And so if a student waits until after July the 1st to submit their insurance waiver, they might see the charge, but once they submit the insurance waiver, the charge will be removed once that waiver has been reviewed and approved. For instructions on submitting a waiver, that information is located on our website at uab.edu/students/health/insurance-waivers. And it really just walks students through how to submit that insurance waiver. Once we receive the waiver and it's completed, we then have to go through validate the waiver, at which time we will apply an approval or a denial. Now, one of the things that I often tell students when they submit their insurance waiver, they're going to want to ensure that they submit a copy or a photocopy of the front and the back of the card. Most of the denials that we see is really due to typographical errors. When students are inputting that information, often they will miss a character or miss a number or something of that nature. And so if they actually submit the card itself, we can correct those waivers or correct those errors on the back end. And that would prevent unnecessary denials. And so we strongly encourage students to do that. If for whatever reason we don't have the image and it won't validate, we will decline it. And usually we'll send those students a portal message to let them know the waiver's been declined, at which time they can contact us with the corrected information. And so how do students submit both their immunizations and their insurance information? Everything for Student Health Services is done through the patient portal. We don't collect paper on any of these things. And so to get this information to us, all a student has to do is log into their patient portal, and we consider the patient portal kind of the one-stop shop for Student Health Services. In the portal, students can schedule appointments, cancel appointments, check their immunization status, or submit those records. They can also submit their insurance waivers. They can send us messages if they have questions. There are multiple different contact groups through which a student can kind of proceed through to send us messages with questions, and we can definitely help them that way. That's probably our preferred way of contact. And so a student can get to the patient portal through our website, which is uab.edu/students/health, or they can actually get there through the BlazerNet system, which is the same system that they register for classes for, check their student account for balances, and order their textbooks and all of those things. There's a tab on the right side towards the bottom that actually links to the patient portal. So once a student actually logs into the patient portal, they will see both the insurance waivers tab on the left-hand side as well as the immunization tab. And once they click on those, there are actually instructions embedded there that can help them as far as getting everything submitted. And so again, to meet these requirements is very simple. If your student is uncertain of what they need to do, all they have to do is go to the patient portal and click on those tabs, and it kind of walks them through. I don't feel like I talked very fast. However, that was the last slide. And so we do want to open it up for any questions that the viewers might have so that we can ensure that we can answer those.
Perfect. And again, just to remind us, I see some questions already starting to come in. For those of you that are potentially watching us on Facebook Live as well, if you have any questions there, please feel free to put those questions in the comments box section, because we are monitoring both sections of, or both platforms. So what are the question that's coming in right now is, what are the costs associated with them going to care, any lab works, prescriptions, and then does that bill to insurance, and with the family paying the difference between whatever insurance would work, or how would that process really work at UAB?
Sure. So when students come to UAB Student Health Services, we don't collect copays, and in most cases with the insurance, the deductible does not apply. There are some insurance companies that do apply the deductible, and so what that means is that a student might get a bill for services after the fact. There are some services that we have that we bill out to insurance, and we actually submit the waivers ourselves in regards to the copays, and so students might not get a bill for the copay, but they might get a bill for the professional component. With regards to lab, x-ray, and all those things, the labs that we collect at Student Health Services, we send those to Quest, and so if a student is going to get a bill for any laboratory services, they would probably get a bill from Quest. For radiology services, we actually have the capacity to do the x-rays on site, but and that's the technical component, but for the actual reading of the x-ray, that actually is done at UAB Medicine. And so UAB Medicine actually bills that out. And so students don't have to pay anything at the time of the visit. And there are some things that actually aren't charged at all, and those are considered under the student benefit. And those are consultations or sprains or different things like that that are non-invasive. But for anything else, a student can come in, have the service done, and if there is a bill associated, then they would get that bill after the fact.
Great, thank you. There is a question coming in. If their student is tied to as the UAB system is so integrated, if their student is at the UAB, is a patient at UAB Huntsville, do you know if the records will be able to transfer down or accessible down here in Birmingham?
No, they're not. So when you say UAB Huntsville, are you talking about UA Huntsville, or are you talking about one of the UAB extensions? Do you know which one it is?
I would assume it seems like it potentially is an extension.
Why don't we address both? Okay. If it's UAH, the University of Alabama at Huntsville, we do not have those records. The student will have to request their records down there and actually bring them. That's a health clinic, student health clinic, but there is no shared record. If it's UAB Medicine, the same thing does apply. They need to request those records and they need to bring them with us. Since it is UAB, there are some times that we can actually assist the student by contacting them, but we typically will recommend that the student contacts them first and get those records, because all that data is protected by HIPAA.
Great, thank you so much. Okay, the next one's coming in about, again, there are several that are obviously coming in through the health insurance and making sure that everything is, that we understand. And this is one about if the providers are in network, the example being, you gave the mention of lab work being sent to Quest.
Yes.
And that is not a preferred provider for their particular insurance for this example.
So for most insurance companies, we actually check to see who the preferred lab is. The primary lab that we use as our preferred lab is Quest, and that's also the preferred lab on the student health insurance plan. But we do check the insurance plan to see who the preferred lab is prior to us sending that information.
Oh, that's wonderful. That's great news. This next one I think is really a very important question, and that doesn't necessarily per se isn't your area, but I know you'll be able to speak to the bigger, broader side of it all. And the mental illness and how it most often appears during the time that a student's in college. Yeah. And so the family member is wondering, how is this handled at UAB? How do we work to get students help? And then I'd like to even add on, like what type of services are available. I will say just before I send you down a rabbit hole on that, there is going to be a presentation, a webinar on our UAB counseling services in the month of July. So there is going to be a further explanation. So you don't have to please don't feel to go into all of their services, because there will be a webinar for them. But I know you can answer some of that.
Yeah, sure. So as Meredith said, there is a department that specializes in providing care for the mental health services needed on campus for students, and that is Student Counseling Services. And we do partner with them and work closely with them on the care of students, and integrated approaches that is certainly the best approach. And so we work closely with them. At Student Health Services, we do have embedded mental health services available. And so we actually have a psychiatrist on staff as well as a mental health nurse practitioner. And they can help students if they have situations that need medical management. The Office of Student Counseling Services has a whole host of staff that are licensed clinical counselors. And they really engage in the bulk of the mental health services on campus. But again, Student Health Services does support that effort, and we offer any support that we can for students. I hope that answers the question.
No, that does. That helps a lot. And I just want to reiterate that there will be a webinar specifically on our UAB counseling services in July. I want to say that it is going to be on Tuesday, July 14th. So there'll be more information. You can sign up for it through the family website, Parent Family Services website, or through Campus ESP. But that is coming. So just as an additional thing there.
I would also say too, if parents are interested in seeing what some of the services are that Student Counseling Services offers, I would recommend visiting their website at uab.edu/students/counseling. You can kind of get an overview of not only the services that they provide, but also the resources that are available to your students once they get here. And that is a service that's completely free. They don't bill, they don't collect insurance information. It's completely free for every student. It's something that the institution feels is of great importance. And you can tell that just by the way that the services are set up.
Agreed, 100%. The last one that we've had coming in, and again, families, as you've got more additional questions, please let us know. Again, put them in the Q&A function if you're part of the live stream from Zoom, or if you're watching us on Facebook Live, please make sure you just put them in the communications and the comment section. This one's a respective thing. Do you know if, and this one may be specific and you may not be able to answer without having to run through everything, if it's related to a specific insurance, if UMR via United Healthcare is considered an accepted insurance?
I don't know. I would have to look. United Healthcare we are in network with United Healthcare, but there are multiple branches within United Healthcare, and I would have to look specifically at that plan. If a parent or a student has a question regarding that, they can always email us at studenthealth@uab.edu. It does help if we can actually see a copy of the insurance card, and that way we can actually verify before we tell you yes or no that it is something that we can accept or not, or that we're in network, or that we can accept it in a waiver. That's the best way to get that question answered.
Perfect. That makes, I knew that one was going to be a long shot, but I thought that again, since there are so many variations of things out there, that just knowing how to go about that is helpful. Yeah. And it looks like a family member's already started to ask some questions regarding they've already started doing their compliance stuff for immunization. So if they're looking at their immunization record through the portal and it says compliant, does that mean that that they've reached everything?
Yeah, if they have green checks for everything, that means that they have met all of the requirements. And the student would actually, if they go to messages, they should see a message from one of our medical clearance staff confirming their compliance. Every record that we review, someone on our medical clearance staff will actually send a student a portal message letting them know that either one, you've submitted everything, or two, you almost submitted everything, but these are the additional things that are needed. And so definitely have your student check their messages just to ensure that that they're compliant. If you see all green checks, though, you should be good.
Excellent. And then, to no surprise, we've got a question coming in about COVID screenings for reentry starting this fall.
Yeah, so the institution is currently in the midst of planning what reentry is going to look like as far as screening for COVID. We will have education that's going to kind of educate students on everything needed to help protect the campus with regards to COVID, and that includes social distancing, mask, hand washing, sanitation, all of those things. But as far as the actual testing component, that's something that's still under discussion. And so as those decisions are made, more information will be provided to your students. We would encourage them to check their UAB email address. That's primarily the email address that a lot of the communications are going to be sent out to from the institution. And so as those things become available, just ensure that your students are checking their UAB email so that they can get those updates.
Perfect. And that, triple checking to make sure one last time. I think those are all of the questions that I've seen come in. Carol, are there last minute tips or last things that you want to make sure that we are leaving all of our family members with regarding your specific area? To make sure that
yeah, of course. I usually always recommend the same thing. You know, parents, your students are going to come to college. They're going to have this first year away from home. They're not going to have mom and dad with them all the time. And honestly, one of the biggest things that students struggle with that first year is honestly just self-care. They are so busy with classes and studies, and often they have so many other obligations. And very quickly, self-care becomes kind of a thing that gets faded into the background. And unfortunately, when that happens, that's when they start to catch colds and get sick and, you know, start to forget hand sanitation and all those things just because they're running from A to B and trying to eat in the middle. And so parents, I would always encourage you just to kind of really encourage your students over the summer to really think about their self-care, think about self-hygiene and all of those things, so that when they come to school, they have those really good habits and they're already cognizant of all those things to kind of help to prevent them from catching colds. And we certainly are going to do everything we can to prevent them from being exposed to coronavirus. And but we need them to partner with us. And so just encourage your students with regards to self-care, hand sanitation, wear those masks, and social distance.
That is excellent advice and very true and very sincere on that one. It does definitely turn into a much bigger scenario sometimes than what they would normally have experienced. I also want to say, I know Carol mentioned the patient portal and the communications would go through that. I verified this with Carol earlier, that information does also populate messaging to the student's email address. Mm-hmm. But it's going to go specifically to their UAB email address. And so you have heard this already, family members, several times, I know, but just making sure that everyone knows that to remind your student over and over again to check their UAB email. Mm-hmm. And that message may just say you have a message waiting for you in the patient portal. So there's an extra step that they've got to take care of. And that message could be critical information such as, we're missing something for your health insurance, you're still missing something in regards to your immunization that you all have the answer to. Our students sometimes just miss that extra step, and that can sometimes put them behind, or in the case of the health insurance, cost you some extra money if you're not careful. So just remind your student to continuously to make sure that they are really checking that UAB account, because that is going to be the preferred and main way that we're communicating with all of our students.
Yes.
So, well, Carol, I really want to say thank you so much. I do want to take one quick second because I realized one thing we didn't talk about in any of this in regards to, since our students are 18 or older for the predominant amount of our students, regarding HIPAA requirements and releases.
Yeah, so once students come to college, they are classified as adults. And so because of that, with both us balancing HIPAA and FERPA, we actually do have to deal directly with students, or what we would call patients, with regards to any of the very things that, you know, we collect in our EHR. And so anything associated with their health, you know, that's visits, even once they submit their immunizations and all that stuff into our portal, we really do have to speak with them directly. If a student wants us to have the capacity to talk to a parent, they actually have to sign a HIPAA release form. And that is something that they can do in our EHR. The documentation is actually located on our website as well, but they actually, no, it's not. It's located in the patient portal. They would have to sign that release in order for us to talk to parents. And usually if a parent contacts us, we will give that information as well. And so if that's something that you think that your student is going to want to do, just remind them to submit their validation, allowing us to release that information to you, and then we can. And that is something that they would have to do annually. They can't just sign one and it applies for all the years that they're here. They have to sign an updated one every single year.
Yes, and I just got a question from a family member that I just responded to, but just as well, like if the student is even 17, because I know that comes into play as well, but that once you enter college, these rules and regulations go into play.
Yeah, once you enter college, those records are your specific records. And so the student would still have to sign a release on file for us to release those records.
Yes, exactly.
And that's something that falls under FERPA. I know from a HIPAA standpoint, we often think, 18, they have to be 18, and once they're 18, then that applies. But with FERPA, once they enter college, it becomes part of their official academic record. And so they have to sign a release.
And we can go on with FERPA. Since we've mentioned FERPA, I will just also indicate again that also means that their academic and financial records are also your students. So in order for family members to see grades and financial reports and things along those lines, your student has to choose to release that information to you. You can do that very easily. You can request that from your student, I should say, very easily through the campus the Family Hub and creating your account there. But that is something that your student owns and shares with you. We will go into there are additional webinars coming up. There's actually one next week on financial aid and scholarships that will cover some of those requirements and how that works, as well as some other ones related to FERPA specific and using the Family Hub at a later point this summer. So again, though, I just want to take the time to thank Carol for sharing this information with our family members. If you, at any point, family members, after today's webinar, have any additional questions, please do not hesitate to contact the Office of Parent and Family Services or Student Health Services. And we work together very closely, very often, so we can easily get those questions answered for you. We want to make sure that this is a smooth transition for you and your student. But please reach out to us, especially as after today's presentation, some additional questions may pop up for you. We will be posting this presentation out on the Parent and Family Services website within the next week. So that way you will have the ability to go back and refer back to these presentations if there's something that you knew Carol mentioned something, but you can't remember exactly what, you can refer it back to, or you can share it on with somebody else that you think should be able to see this presentation and learn this information. So I just want to say all of that, but beyond anything, I just want to say thank you to Carol, and I really appreciate you doing this today, and that I hope everybody has a wonderful, healthy and safe weekend ahead.
Absolutely. Thank you.
Thank you. Have a great one, everyone. Bye-bye.
Bye.